I think that this project has helped the New Orleans community have a new strategy and a new plan for the care of chronically ill patients in their centers. There are three main things that we did in this project. The first was to help the centers implement the chronic care model. The second was to have the centers really have a care team approach to the care of their chronically ill patients. And the third was to help them improve their use of health information technology and more effectively use their electronic medical records. The chronic care model really gives them a new approach to caring for chronically ill patients. This means that they are proactively outreaching to patients to get them in for any labs they might need or extra coaching or care that they might need. And they're not waiting for patients to come in when they're sick and only seeing them then. They're really proactively reaching out to them. In terms of their health information technology, we really wanted them to have tools and data that they could use so that they knew which patients needed an extra focus, which patients needed care management, and we helped the centers to figure out what are the roles and the responsibilities of a care team. What does a care manager do? The centers are not used to this kind of approach. They're used to having one doctor basically provide all the care for a patient, and these chronically ill patients really need more than one doctor visit can provide. A care team approach means that the patient's benefiting from a visit with not just the doctor or the nurse practitioner, but possibly a nutritionist, a health coach, possibly a visit with the pharmacist. So the patients are really benefiting from this care team approach. And it was really important to get these roles and responsibilities documented in their protocols and to get job descriptions clarified so that the work could be sustained going forward once the collaborative was over. The registry reports and the improved health information technology means that these centers have data to use, and they're risk stratifying their patients so they know who is really the sickest of these patients, and they can focus their care management activities on providing intensified care for these patients. Lastly, I think that the fact that the centers in the New Orleans community now have a functioning health information exchange is really significant. It's a huge step forward for providing coordinated care to these patients. And I think that this project has really brought together technology with a patient-centered approach, and that's going to result in, as I said, more coordinated care and more personalized care for these patients. I think that out of this Beacon project, patients are receiving better management of current problems and more prevention that's aimed at reducing future problems. We're really confident that we will continue to see improved outcomes for patients in this Beacon community.